Peace, mercy, and blessings of Allah be upon you. Many people have asked me in the comments about a broken nose and what is done for it. And how do we know if we have a fracture? Well, the nasal bone is one of the most common bones in the face that can get fractured. Yes, a fracture can occur if the blow comes from the side or from a collision in an accident or something like that, causing a fracture in the nose. We can identify a broken nose by the change in the shape of the nose. It swells and there is significant swelling. The person cannot touch their nose or anything else. Sometimes their nose becomes blocked. The swelling can be so severe that it reaches the eye. Sometimes the swelling is so much that the person doesn't notice the change in the shape of their nose. Well, sometimes, of course, there is bleeding from the nose, which is quite normal and can happen whether there is a fracture or not. I mean, with the impact, there can be nosebleeds, even without a fracture. So, how do we know? Ideally, as soon as we get hit on the nose, there should be blood. Or if we notice severe swelling, severe pain, or a change in shape, we go to the hospital immediately, or the doctor performs an X-ray. Sometimes the regular X-ray doesn't show much and we might need to do a CT scan, and the examination is a bit more reliable than a regular X-ray in predicting the presence of a fracture or not. We also go to the doctor to check inside our nose to see if there is a blood clot in the nasal septum or not. What does a blood clot in the nasal septum mean? It doesn't mean that the blood is coming from your nose. No, it means that the blood trapped, forming a clot inside on the nasal septum. This is very common in children. If not treated properly and the accumulated blood is not drained, it can change the shape of the nose, cause an infection, sit, and erode the nasal cartilage to the extent that it causes a collapse in that area of the nose, leading to a change in shape and undesirable deformity. So the first task is to determine whether there is a fracture or not. We do this with an X-ray or an examination to find out if there is a blood clot on the nasal septum, so we can treat it or drain it immediately before it causes a problem. After that, we can only treat it with a difficult cosmetic surgery. If there is a fracture, we have two options. If there is severe swelling, we wait until it goes down within a week to do and then take compresses. The swelling subsides. Then we address the fracture within a week. Sometimes we can set the fracture under local or general anesthesia. Just setting the fracture. This usually yields good results in most cases, as long as the fracture is simple. But if it's a larger fracture or a significant problem that hasn't been fixed, and when we try to set it, it doesn't return to a good shape, we wait 6 months after the injury. Then we proceed with cosmetic surgery. Of course, this does not apply to children. For children, we leave them until the age of 18. As for adults, we can proceed 6 months after the fracture or the surgery, if the setting didn't yield good results. We can perform cosmetic surgery on the nose to adjust its shape and improve its function. Immediate intervention is only for 2 reasons: to stop the bleeding if there is any, or to drain the hematoma in the nasal septum if present, and wishing you a speedy recovery. If you like these videos, give them a like and subscribe to the channel. Hope to see you soon and wishing you a speedy recovery.